Hey, everybody. I think we'll go ahead and get started now. First of all, my name is Jason Hines. I'm CEO and co-founder here at Gigasheet. And thanks for joining us today. We're going to talk about some price transparency data for healthcare and how it can be used in to gain a competitive advantage. We'll talk about a few different use cases there. Um, Please feel free to ask questions in the chat panel or the Q&A. I'll try to get to those at the end of the session, so feel free to ask. You can ask anytime, but I may not come to it until the end of the session. Um, with that, we'll go ahead and get started here. We'll go through a few slides and then we'll dive into the product and look at some data. We'll see how that goes. Always live demos are always fun on these kinds of things. We started Gigasheet in about 2021, where really the whole idea behind Gigasheet is making big data easier to work with. Um, you know, if you could access this price transparency data in Excel, it would probably be great, but unfortunately, that's not possible for a variety of reasons. One is it's just massive. The data sets are too big. So typically, what that means is you have to get a data team and databases and infrastructure, and that's kind of a lot of work just to look at rates that are supposed to be transparent in the first place in the healthcare space. So the whole idea behind our product has always been making it easier to work with really large data sets. So that's sort of the ethos behind our company. And price transparency data is certainly huge. The data is massive and it's very messy. We're going to talk a little bit about that. If you've ever tried to work with these raw files, you know how challenging it can be. Or if you've looked at other possible solutions on the market, you may have noticed that the results are lackluster, or even flat out wrong in many cases, and we can discuss why. There are a lot of nuances and complexities with this data, and we're working to make that just a lot simpler and easier. So I mentioned some of the issues that surround price transparency data. One is just the sheer size of the data. We process routinely every week many terabytes of data, payer data, hospital data as well. And they often include zombie rates, which you'll see. One of the things we do is we enrich the data with NPI details. And then you can see, well, it doesn't really make sense that a chiropractor would be performing a particular procedure like eye surgery or heart surgery. And you end up with all these sort of mismatched rates with providers who would never provide that service. It can be misleading. There are also sometimes just flat out wrong data, but the outliers in Gigasheet are easy to spot. Like sometimes you'll see just eight or nine nines put in for a rate, and obviously that's a placeholder that someone forgot to take out. So there are all kinds of other issues I could go on, and there are also issues with how you interpret the data. There are a lot of detail included in these MRFs, and it requires some market knowledge and expertise. I've become very good at working and understanding the data, but I'll just be upfront and say, I'm not a market expert in healthcare, and our company isn't. We're software engineers and experts in data and data analytics, and that's sort of the angle that we came at this problem with. We've been seeing price transparency data in our system since the rule was passed in 2022, and frankly, the data was not workable. I don't mean that the data was not relevant or correct. I mean the files and were actually malformed and in a sense corrupted and not really able to be used or relied upon until really last year. The fidelity of the data started becoming much better, and it has really become useful with proper preparation and interpretation. So we're going to dive into some of that today. One of the things that we see that it's used for a lot ends up having to do with growth and specifically competitive intelligence or gaining competitive advantage, which is the whole idea behind the price transparency rule in the first place, which is to increase competition. And that should be a good thing. So there are a bunch of different use cases that we routinely see people using this data for to, like I said, gain an advantage in the market and help drive their business. So providers are using the data in a variety of ways. And there are always, these are not all of the use cases, but these are just some that we'll talk about today. So providers are using price transparency data to assist in their contract negotiations and understand market intelligence. Are they being paid fairly in the market? What are their competitors being paid? And that data is published and able to be gleaned from these files. Payers are using this. Insurers are using this data, of course, also to see what other insurers are paying in the market for specific procedures and to which entities or providers, but also to develop their networks and expand their networks and offer stronger contracts that are more competitive to providers. And then we have this third category, which I've called medtech, but it really spans everything from pharma to life sciences and medical devices, really where you're working on market access use cases or reimbursement, where you're working to provide evidence or backing um, financial models and things like this. So I'll touch on each of these and we'll dive into some examples in Gigasheet. Um, and I'll talk a little bit now just about Gigasheet and how it works. So first of all, we source MRFs and perform the ETL, extraction, translation, and loading of the data into our backend data warehouse. So you don't need to set up any infrastructure whatsoever. It's totally turnkey. The other thing I'll mention is this platform, when we sell our solution, it includes access to our data catalog of pre-processed data for payers and hospitals, but it also serves as a workbench. So if there's data that you want to work with that isn't in our data catalog, you can drop those files into Gigasheet and it will process them and turn them into basically a spreadsheet automatically. So we'll talk a little bit about that. But when an MRF, regardless of how the data gets into Gigasheet, it goes through a cleansing and enrichment process where we do deduplication, we enrich it with NPI and taxonomy details, and then remove zombie rates. We also often will layer in Medicare reimbursement rates that are regionally adjusted based on geography. We can enrich the data at this stage with any number of different sources, whether that's quality data, claims data, or even like B2B sales intelligence for folks who are selling actual equipment or DME or medical devices so that you actually have clean data there where you can start using it in sales and marketing campaigns. And then, of course, the delivery and analysis stage, where really what our goal is to get you access to the data in a clear way so that you can do that final mile of analysis in a really flexible, user-friendly interface. And that's what we'll dive into. And then, of course, the data can be refreshed periodically as needed. So that's a little bit about how Gigasheet works. It's sort of like platform plus data plus tools all in one for working with this information. And this is a screenshot of what it looks like, but there are lots of views. And I should mention in this last step here, the delivery and analysis, we typically will work with our clients to create customized reports or views. Once all the hard work is done higher in the chain here, it's relatively easy to create flexible views of the data that can easily be exported to whether that's just to flat files or for something like Excel, or to be shared within Gigasheet, or to be pushed to other systems like CRMs or data warehouses. And we have hooks and integrations for that. So with that, let's dive into a few of these use cases. So if I go back here, I talked about providers, payers, and medtech, and those are the three examples I'm going to dive into and we'll just take a look at and talk about today. So first of all, let's talk about providers. So here's an example of some prepared data, a report for, in this case, Austin, Texas, and we're looking at family practices. Um, the cool thing about this slice of data is we actually filtered it to specific NPIs. So here you can see for this particular CPT code, I've got it grouped by billing code and then by group, in this case, provider group. So you can see here, these are the competitors that we're looking at in the Austin, Texas market. We've got One Medical, we've got a regional clinic here, Baylor Scott and White, and then this Austin Regional Clinic organization as well. So I should mention that under each of these, not only did we take the organization MPI, but we also took the MPI for all of the providers associated with that organization. Sometimes they may bill under their individual NPI, and other times it may be billed under their organization. So one of the things for this particular example, and typically what we'll do for competitive intelligence, is look at both levels. So as we see here, this is just kind of your typical 30-minute office visit. We can see on average, the rate that we're getting is $119. Gigasheet includes the ability to create other aggregations as well, but we're just going to use average in this case. You can see here, we've got these four groups that we're looking at in this particular market. You can definitely see on average, there are some differences here between the rates that they're looking at. Now, in this pre-configured report, I'm filtering to just look at negotiated rates. There are also fee schedule and percentage rates available in the data, but for this analysis, we'll do that. I'm also restricting it to no modifiers for billing codes. Um, there could be modifiers for things like if there were complications or things like that. And then in this case, I'm only looking for those service codes or place of service where it's in the office. So some of the complexity with this data is not just like removing the noise, but also making sure you're comparing apples to apples. In this case, we want to look at office visits because they may have different rates if it's provided in an ambulance or provided in the hospital. So in this case, we're looking at 11, which is office visits, which for this example is what we'll dive into. So now that we have those filters set up, we created these groups so that we can easily dig into this data and start to look at the actual rates and then the individual MPIs here and drill down even to the exact files that this data came from. So here we're looking at a lot of data from Blue Cross Blue Shield. And if we expand this even further, you could see that there are multiple plans within this. Actually, I'll click on this and we'll go to this view here. So that you could see that, we have HMO plans, but as I scroll through this, there's also like PPO as well. So you could drill down to the actual plan and see where the data came from. And as we sort of sift through this data, you can definitely see here that there are different rates that have been negotiated um, for these particular procedure codes here. So like here we've got the My Blue plan, Blue Advantage, and Blue Choice here as well. Just move this here, make it a little easier to see. So this is an example of how a provider might use this data. They're in contract negotiations with a payer or just to benchmark themselves and make sure they're being paid competitively for the market. And in this particular report, we did a whole basket of different CPT codes because this was distilled down across multiple payers and billions of rows of data. But really, you're just interested, like in this case, it boils down to just about 4,600 rows of data when it's all said and done. So that's an example of how a provider might use this data. Now let's talk about payers, and we're going to shift gears a little bit, and we'll talk about network development. But if you're looking at this through the lens of a payer, you could imagine how you might also use this exact same example here to see if the contracts that you go to providers with are competitive. So if you are maybe offering only $50 for this particular office visit, and you're not really seeing adoption, or the providers aren't really active in your network, you could imagine why, because these particular practices here are commanding, you can identify the rates in the market. But let's look at a different, let me pull up a different file here and see. I had it open, but I think I closed it. Let me just go over here and see. Maybe flip this. That one crashed. So, to pull it up, give me 1 second. Go through all my files here. Mm, There's some national data for Blue Cross Blue Shield, but the one I was actually looking for, I think was this one. Give this a try. Let that load for a second. And then here I've got nationwide data. So in the previous example, I was looking at like super local, just Austin, Texas. In this example, we're loading 434 million rows of data across all of Blue Cross Blue Shield nationwide. And I've got it filtered to just a handful of CPT codes. So I could drill in from this perspective, in this case, to look at that data. But let me see if I can pull up this other example. Maybe I'll jump while that's loading since I had closed the tab before. We'll jump to the third one, which is medtech and medical devices, or even pharma and life science data when you're looking at more from market access. In this case, we're going to look at hospital data. You'll see it looks very similar in terms of the columns that we have available, but there are some definite nuances. In this case, we're looking at Mayo Clinic in Rochester, the headquarters location. And you can see here all the different um, negotiated rates they have with payers in the market. So in this case, we are filtering to just this particular drug. In this case, it's a chemotherapy drug. And we only want to, again, it's super important to look at apples to apples. So we're going to look at 10 milliliters here. And we want to exclude Medicaid and Medicare in this case. So really just look at commercial payers and what they're getting paid for this. So in this case, we can see that here at the top, we have Cigna, and I've sorted it in this case by estimated amount. And then as I scroll through, you can see there's definitely a range here, and we could page through to the second page as well and see exactly which payers are getting paid or have a negotiated rate for this particular drug. And you could drill down here and see exactly what the rates are for each of them. So if you're looking at this to compare, like let's say you're coming out with a new drug and you want to see kind of what negotiated rates are with payers. Let's say you're going to a new hospital system and you want to compare and say, well, look, like here's, for example, let's say you wanted to go to MD Anderson, you could say, look, this is what Mayo is getting for this particular therapeutic treatment, for example. So that's how you might use it, and how sometimes we see medical device, med tech applying this data as well. Let me see if my Medica data finally did load. In this case, it looks like it did. Um, so in this example, we're just looking at Wisconsin and Minnesota. And what we want to do is target particular providers. So the way you could do this here is start to group by a particular billing code or group by provider and see what, if you're a competitor to Medica in this market, you could see exactly what they are paying providers in the space for specific CPTs And you can even group this by, I believe this file also has the provider data here. So if I wanted to just drill in to um, Slater Surgical here, I can filter to that. And if I'm targeting this group as a payer, an insurer, and I want to see kind of what their rates are across the board, I can then do this and get an idea for like high volume rates for a particular provider, what they're getting paid. So this will take a second to chunk through it here. Um, and I should also mention along the way that for all of these, like once you have the data, the billions of rows of data kind of down to this level, it's easy enough to export it. I think I mentioned that before. So you could download it to CSV, for example, can also share these views right in Gigasheet. So if you have a specific view or layout, maybe one that we've configured or you've built yourself, you can save it here by adding a view, and you can send colleagues a link to this so that they can analyze it themselves. This thing finally did load, and so now we've got these negotiated rates for this specific provider, which I've filtered to here. I could add others. So if I'm targeting a particular practice group here, I can drill down to that and kind of see and compare like what is our contract rate for these CPT codes that we have with them, or what should we approach them with in this market. Um, this is just for Medica, but frequently we'll combine, as I showed you in the provider, we'll join data from multiple payers in a single market. So you really get that holistic view. Very simple to create these kind of final mile analyses of the data. The hard work is all done by the cloud and our data warehouse behind the scenes. So hopefully that gives you an idea of some of the ways that people are using price transparency data and putting it to work to gain a competitive advantage in the market. Uh, and thank you. That's pretty much what I had planned to discuss today. Happy to take questions. So please do put those in the Q&A panel. I saw a couple of those come in earlier, so I will get to that, but you can also send it in the chat if that's easier, whichever way works for you. Um, so here was one question. Are you using Snowflake? No, actually, our backend is not based on Snowflake. Sort of technical question, but we do definitely integrate with Snowflake and often push data to Snowflake. We have done some other things that actually we think are cheaper and more efficient than Snowflake, but it's definitely great for output. Let's see. Here was another question. How do you price solutions? So. We have packages actually for each of those that I described. So we have provider packages, we have payer packages, and then we have medtech as well as other solutions as well. But generally speaking, the price varies based on geography and the number of payers. So if you're looking at nationwide, that's usually different. Often, when we do nationwide, it's only for a specific discipline or subset specialties and CPTs. So it's a little different. But typically, for regional stuff, it is based on payers and states, honestly. Here's another question. How many payer sources do you have? Do we take requests to add payers? Yes. So I don't know how many payer sources we have. We definitely have all the BUCAs, and then we have a whole bunch of regional payers. One of the cool things about Gigasheet is, as I mentioned, it's like a workbench as well as a data catalog that's pre-existing. So we routinely drop in new regional payers all the time. Like pretty much every day of the week, we're processing new data. And depending on the amount of data, it can take just a few hours. Sometimes it takes longer, it takes a few days. But one of the strengths of Gigasheet is the ability to process data on demand. So, like we have hospital data for 5,000 or so hospitals nationwide. There are more. There are probably like 10,000 hospitals nationwide. And it's easy enough. Like hospital data is typically much smaller. That can be done in a few minutes even. We often teach people how to drop data in Gigasheet themselves to just load the data, but we're happy to do it as well. It is something we take requests for and do all the time. And it's super useful because sometimes you want to compare like Aetna nationwide, Blue Cross Blue Shield nationwide with like a regional payer that may be more competitive. So that is a good question. Um, how does Gigasheet handle large scale data sets in terms of performance and real-time collaboration? Um, so Gigasheet scales, we say to a billion rows in a single data set. Many of these price transparency files go much larger, 3 billion rows. There's not a hard fixed limit on the scale of the data set, but obviously, if you're dealing with 3 billion rows, the time to query is going to be slower than if you were dealing with 100,000 or 100 million rows. So, pretty, you got probably a decent sense for it. Like I loaded this Blue Cross Blue Shield data here. It's a 500 million rows of data, and you can tell like it takes some time. Like I could adjust some filters here. Oh, am I not? I forgot. I'm not sharing. Let me share my file again. Yeah, so this is the Blue Cross Blue Shield data, and you can see here I filtered it to like 3 CPT codes. Um, but if I just reset this and go back to the raw sheet, okay, so it took a couple of seconds. So I think it's pretty good for a 500 million rows of data, but you can obviously uh, judge for yourself on how this works. So like I'm querying it right now. Like let's say I want to just do only negotiated rates here. Um, and so what's happening here is I'm starting to build up this query. So you can tweak these however you like. So maybe that gives you some sense of it. In terms of collaboration, right now, like at this moment in our system, we probably have about 100 concurrent active users. We've had over 160,000 people sign up for Gigasheet. So I'd say we scale pretty well. I think we scale pretty well. And you know, mileage may vary. If there's, for example, 200 people on it tomorrow, it could be a few milliseconds slower, but we keep a close eye on that stuff as well. Um, Let's see, there's another question here. Do you work with allowed amounts files? Yes, we definitely work with allowed amounts files as well as in network. I will say the allowed amounts files are very sparse. So the out of network rates are uh, they just don't have a lot of data in them. But we absolutely work with that data and deliver it alongside the in-network rates as well. We'll pull anything that's published, whether it's published by I mentioned the ability like to join or enrich data. So whether it's from payer, like joining hospital and payer data, joining hospital, payer, and CMS data, I mentioned quality data, it once it's kind of in there and organized, it's relatively straightforward to join data sets. We even have a feature that you don't need us to do it. It's called cross-file VLOOKUP. If you're familiar with Excel and VLOOKUPs, you can join data, integrate data yourself that way as well. So let's say you have a list of EINs or TINs for contracts, and you want to exclude those from your analysis. You could easily join that in and then filter on that. Um, let's see. Those were the questions. Good questions. I'll take. Oh, do we have visualization capabilities? We do. We're not a BI tool. We have basic graphs and charts. I could just show a quick example of what you can do. Um, So this was this isn't super interesting because they all have three, but once you've done a grouping and an aggregation, you can build charts and you can export these as well. and these are maintained. So if you came back to this sheet tomorrow or reloaded it or shared it with someone, they would also see the visualization as well. Um, the let's see, the visualizations are okay. I should also mention though, we do provide links to popular BI tools that really are specialized in all kinds of so many visualization tools out there. We just didn't think it was worth building yet another data visualization tool. So we have hooks so that you could use popular BI tools here as well. So that's a little bit, we do some visualization. I would not say it's uh, like super sophisticated. It's really just the basics, bar charts, pie charts, that kind of thing. Um, let's see here. Uh, yeah, different solutions, subscriptions models. Um, it depends on it all really depends on the size of the data and how much data that you want to work with, honestly. Um, as I mentioned before, it's typically done by payer and by state, but we also do nationwide as well. So drop us an email. You can drop us an email at sales@gigasheet.com and let us know kind of what you're interested in. We do have standard rate packages, like I mentioned, for like regional provider reports, like the one I showed for Austin, Texas. That's like a standard package, a regional package for payers where it includes up to like three competitors in the market. Um, so it really depends on what you're interested in. And then for hospital data, um, and often people will just be interested in the workbench itself, like they'll load their own data, especially for hospital data. It's smaller and easier to work with on your own if you're up for it, or if you want pre-baked like kind of views and analysis like this, where you just do the final mile, we'll support that as well. So it really depends, but those are at a high level, how we package the solution. And you get access to the platform for a year with all of these. So if you wanted to, regardless if you're a provider payer or um, someone else, you get access to the platform for a year where you can analyze and drop in your own data, create exports, and that sort of thing. Um, What makes Gigasheet different than the other providers on the market? Yeah, I'll answer that. So there are a lot of people who sell a database, right? So typically you'll get a database. You'll The other providers on the market offer a pre-baked set of data, and you get what you get. And I, I I think they do. I've heard, as good a job as they can as when it comes to things like removing zombie rates and providing relevant data. I guess there are a couple of things that are different with Gigasheet. You always have access to all the row level details and data lineage. So you know exactly where the data has come from and exactly what was published in a specific file from a specific payer. So it's easy to trace that back and understand it. You also get full visibility to all the other attributes of that particular rate, whether it's modifiers or billing codes, uh, or place of service. So you can make a determination. So full visibility and then full flexibility to export it. It's not like locked into a portal. You can create slices of the data on your own that are exactly what you want. So, however, I showed a few examples, but you can slice and dice this as many ways as you could imagine. So part of it is just flexibility. And then the third is the ability to join your own data in. I made reference to like syncing this to a CRM or your data warehouse, but you can also bring in your own data sets to correlate with this. So when it becomes really powerful when you start to join it in with your own data and then filter on that. So let's say I wanted to take these, 434 million rows of Blue Cross Blue Shield nationwide data and filter it by the 900 NPIs that I already have in my network or something like that. Things like this big data, really big data analytics is really where Gigasheet excels. Um, Let's see. Can you export out of Gigasheet? Yeah, you can export out of Gigasheet. I think I showed that earlier. You just go to File, Download, Export. You can download it as CSV. You can split it to multiple CSVs. You can even write it to a data store or database. Does Gigasheet crash? Yeah, it crashes. At times it does, but it's pretty reliable and it we've never lost any data. So sometimes like the browser will struggle with just too many data points, but honestly, we've gotten it to be pretty darn reliable. And you can check our uptime stats if you don't believe me. Um, Getting a lot of questions here. I'll probably take one last question and then I'll leave it at that. The payers update monthly. Uh, do we do you show all the rate files or just the most recent ones? Typically, we'll do this quarterly. You can drop in files whenever you'd like if you are interested in like that particular month's data. And we'll reprocess it. It's not a huge deal for us typically. But the data it does change, but it's not super uh, fast to change. So typically quarterly is the cadence that we'll do. There have been a couple of use cases where people needed it more frequently, particularly if you're looking at nationwide data, it changes more frequently. But on a regional basis, I mean, the juice typically isn't worth the squeeze to do it more. We certainly have that capability. Um, Oh, I said I'd do one question. One more came in. All right. So, what business insights can we derive from comparing private payer rates with CMS rates? I think. So, the Medicare rates are often what people, when they negotiate contracts, they'll say it's like Medicare plus whatever. So, they'll use Medicare as sort of that benchmark. And when you're looking at different regions, it's important to see what Medicare reimburses in that geography so you can benchmark it as well, whether you're a provider or whether you're a payer, to see kind of what the going rate is in that particular market for uh, people use Medicare as sort of that benchmark. And in some cases, people are reimbursed below Medicare, and that could be in cases where there are a lot of places where you could get, I don't know, physical therapy, right? Uh, so there are different reasons for that, and different insights. It really varies, but that at a high level is why people compare to Medicare, I would say. Happy to continue the discussion further. I know there are other questions that came in. You can reach me at J, just the letter J, at gigasheet.com. Happy to have one-on-one discussions. I love talking about this stuff. We deal with this data all the time, every day. And I'm always amazed at different ideas that customers have on how to apply it in different creative ways. That's definitely one of the strengths of Gigasheet is the flexibility. Um, you can apply it and slice and dice and really shape this data to whatever your use case is. You don't have to kind of fit into a particular narrow use case. So it's not just for hospitals or just for large medical practices. Like it's for really all different people. So I hope that helps. Thanks for hanging out today and drop us an email at sales@gigasheet.com if you're interested, and we'll set up a time to talk more. Thank you.